I'm Thank you for deciding to watch this video. Number 3, fundamental of nursing. Let's get to it. Argued fact, concept you have to know. Straightforward. Number 1 question. Talk about position. How much do you know about position? Which of the following clients need immediate intervention? That means they are in the wrong position that we have to intervene. The nurse is aware of what? 5 clients immediately post-procedure. After a procedure, which of the client need immediate intervention? Keyword post-procedure is client need intervention. Resting on the left side after liver biopsy. The liver is on the right. If I biopsy it, you should stay on the right to put pressure. If you lay on the left, you're bleeding. We got to intervene. Resting on right side after left kidney biopsy. This is your left kidney. If I biopsy it, you should put pressure on it. So you should lay on your back because the kidney on your back. If you're laying on your right side, you're bleeding. You got to intervene. Resting on right side after left thoracentesis. This is your left side. I come here, I puncture your lung. Your right side is good. Therefore, after I puncture your lung, you should lay on the right side so that the left side can heal. So lay on the right side. It's laying on the right side after left puncture of the lung. That's fine. Thoracentesis means removal of fluid from the left, and therefore you should lay on the right side so that the left side can heal. This is good. Resting in supine position after lumbar puncture. Lumbar puncture, we go to your back. After we finish, you should put pressure on your back. Client is on supine, is doing great. Resting supine with head of bed 30 degrees after brain surgery. When you have brain surgery, we should decrease your ICP. Your head at least has to be 30 degrees and you should be supine with your head up. Therefore, this is great. So this is fine, this is fine. The one that need problem is 1 and 2. Concept you have to know in terms of position. Number 2. Which of the following client situation is concerning? You see, I read from the back. A nurse is caring for a client post-liver biopsy. The same thing we talk about concept. I have underlying keywords. Liver biopsy concerning. The liver is on your right. A biopsy it, you should lay on that side. What are the problem? What are the things you should worry about after liver biopsy? Bleeding, number 1. Therefore, every answer choice here, we have to look at in the eyes of bleeding. Concept you have to know. Heart rate of 85 is fine. Urine output 100 ml in the past 2 hours. In the 70-kilo man, supposed to pee 35 ml every hour. So in 2 hours, we're going to have 70 ml every hour. 100 ml every for the past 2 hours is good. Anxiety, it means you bleeding. Restlessness, it means you bleeding. BUN is increase, bleeding. Creatinine, increase, bleeding. Urine output, decrease, bleeding. Tachycardia, bleeding. Hypotension, bleeding. Changing mental status, bleeding. Gray tenor sign, that means frank ecchymosis, bleeding. Kelling sign, that means periumbilical ecchymosis is bleeding. This patient is bleeding. MAP of 75, that means your blood pressure is good. The MAP is 65 to 75 is great. Therefore, the only person that is concerning is anxiety, anxious. Nobody will be anxious just like that. It means they're bleeding. They're asking for something for you to cure them. So 3 is your right answer. Prioritization. Number 3. Which of the following is the best way to teach the client the procedure? And this is teaching a client how to change a dressing using domain of learning. Which one is the best way? There's 3 domain of learning. Cognitive domain, it means you're giving them the information, getting information. Psychomotor, you see, divided into 2, psych and motor. Your psych is your brain and motor is your function. You're doing something. So brain is learning, psychomotor practice. So you let them learn and let them practice. That is psychomotor domain. Affective domain, basically you're telling them how important the learning is and how it affects their life. So if they have diabetes and you got to take insulin in case so that your diabetes doesn't get worse, that is affective domain. There is nothing like domain of learning. The domain of learning is the three of this: cognitive, psychomotor, and affective. Which is the best way? Let them learn and teach you. Psychomotor, number 2. Number 4. Which statement by the new graduate indicate correct understanding? After teaching new graduates, the best method to evaluate effectiveness of patient teaching. This is built up on the previous question. After teaching new graduates, the best method to evaluate the effectiveness of patient teaching, which statement by the new graduate indicate understanding? All it means is if you teach a patient, how do you evaluate them, whether they understand what you're teaching about? Concept, concept, concept. I'm going to say one statement. Best effectiveness of patient teaching is what? Let them demonstrate it. So we call it what? Teach back. Or we call it return demonstration. So I want you to show me what you've learned. Take these materials to learn insulin administration. This is cognitive. You're just showing them, giving them information, and they're reading it. No, that is not effective. You will be perfect if you practice the injection. It's half of it. You're just telling them to practice, okay? Watch and learn how to inject. You just demonstrating to them. That is not return demonstration or teach back. Show me how you will inject the insulin. They're showing you. They've learned and they're showing you. Therefore, this is the best way. It's the teach back method. Number 5. The next is teaching new graduate about learning strategy, how patient learn, right? Which of the following foster learning in client? This is all fundamental, early portion of fundamental, selecting. If you don't even know, look at it. If you have to teach a patient, what situation do you think they will absorb the information? Intrinsic motivation, yeah, they're eager to learn. They're ready. Let's go. Teach me how to inject the insulin. Teach me how to change my dressing. Excellent. Pain, they're not going to participate. If the place is noisy, they'll be distracted. If you use jargon, they're not going to listen to you. You say, hey, let me show you how we administer furosemide in PO in order to increase your urine output and improve your creatinine function, a bunch of jargon. They don't care about that. Okay? If they have visual problem, yeah, you're not going to learn. If they are hearing problem, it's not going to learn. That's why if they have visual deficit, you have to talk to them a certain way. You have to have, if they have hearing problem too, you have to look at them, stay in front of them, be able to communicate information. The only thing there, 2 to 6 is bad for learning. The best one is this. So if they ask you which one in this learning, noisy environment, pain, use of jargon, visual deficit, hearing deficit, the only thing that helps with learning is intrinsic motivation. Number 6. Select a part. Which of the following need further teaching? And next is reviewing new graduate documentation. Which one need further teaching? You see, there's only one word. This is how your test is set. One word, documentation. You should know how to document, right? Documentation has to be what? Factual, 1. Should be objective, what you observed. It should be subjective, what the patient is saying. The family member is part of it, right? There should be no slangs associated with it. You should document right after you do your assessment, not before you do your assessment. So which one of it? Client agreements with abdominal palpation, right? That is what you saw. So this is an objective value. It's what you observe. So this does not need further teaching. Client said, my pain is 5 out of 10. That's good. That's objective. This is subjective. What is what the patient is saying. Okay. Client wife said, this is what the wife said. This is what the wife saw. No bar movement today, right? So this is what the patient are telling you. Subject the patient family. So that's fine. I think the client fell due to weakness. I think, no, you should not bring anything. It's what you observe and that's your objective, and what the patient tell you is subjective, but not what you think. I administered 2.0 milligram of morphine IV. This is bad. This can mean 20 and AM. Why don't you say morning? So which one need further? 4 and 5 are not good, right? They are not good example. Okay, number 7. After teaching a new graduate about objective data, so objective data, which of the following indicate correct understanding of that objective? Like I say, is what you, the nurse, observed. Okay, what you observe. My pain is what? 6 out of 10. This is a subjective. This is what the patient is telling. I'm very tired. I need rest. This is what the patient is saying, subject. Systolic ejection murmur of what? On auscultation. This is what you heard. You can change the fact. Your observation, when you listen, this is what the sound that you heard. Systolic ejection murmur, that's an objective value, right? Then heart rate 55 at rest is an objective. This is what you saw. This is what you got. Refuse exams today. The client refused exams. It's an objective. This is what you saw, not what the client told you. This is the way it's written. I refuse exams today. It's an objective fact. So that's 3, 4, 5 are correct understanding. Number 8. After teaching new graduate about what? Critical thinking. Which behavior by the nurse indicate critical thinking? Critical thinking means you know your limits. Okay, that's critical thinking. So that when you have a problem, you call for help. You come up with a problem-solving technique and make a decision using problem-solving technique. Don't use any persuasive idea or logic. Use clinical sound mind. It's a bunch of words. Clinical sound mind. No persuasion, no jargon. You use problem-solving technique, gather all your information, and know your limits. If you need help, you call. That means you're critically thinking. You intervene when needed. Using a belt to move a 400-pound person is not a good idea. You're not critically thinking. You need a bunch of people. Belt alone and you alone, you're going to fall. Using persuasive point to support action, no persuasive evidence. Ask fellow nurse to help with NG2 placement after being taught only once. Yes, if I've been taught only once, I know my limit, I'm critically thinking, I don't want any problem, I'll call for help. Using logical answer to support action, no, wrong. So 3 means you're critically thinking. Number 9. A nurse is giving out a report at change of shift. Which information passed on by the nurse is appropriate at the change of shift? When you see this change of shift question, you see the word change. That's the key word, change. That means you're giving them the most important information about the patient. Any change, significant change of condition. That's the key word. Significant change of condition. Which of these shows a significant change of condition? That is what you're supposed to pass on during change of shift. One word, significant change of condition. Client EKG was normal. Normal stuff, I don't need to know. She can go figure it out. Heart rate has been stable. There is no change. I don't need to know. NG tube has been clamped for 4 hours. Big change. Why are they clamping it? Probably they want to pull it. So the NG tube has been on suction for a couple of hours. Now it's been clamped for 4 hours. So this is a significant change of patient condition. GCS is 15 since admission. Since it's been admitted for 2 days or 2, 3, whatever days is it, GCS is the same. How is that going to help me? You're changing shift because you're telling me the most significant change that has occurred so that I can pay attention to that. The only thing is number 3, key aspect and concept. Number 10, selected apply. And next, performed percussion notes. Percussion during client assessment. Which of the following organ the nurse know the percussion will produce flatness? What that means is, if you're doing percussion exams, which one do you think will give you flatness? That means the sound. Stomach, does it give you flatness? Liver, does it give you flatness? Lung, does it give you flatness? Muscle, does it give you flatness? Bone, does it give you flatness? Stomach, when you do, you get tympany because of air. Liver, what do you think? The liver give you resonance. No, the liver give you dullness. The spleen also give you dullness. Okay? The lung is the one that give you resonance because of air. Muscle and bone, flatness. Once again, stomach will give you a tympany sound. The liver will give you dullness of percussion. Spleen, dullness of percussion. Your heart can also give you dullness of percussion because it has fluid in it. That's why dullness of percussion, things that has fluid will give you dullness. Dullness of percussion, spleen, dullness, your heart, dullness. Your stomach usually have air in it, so it give you tympany. The lung, different sound, even though it contain air, it will give you resonance. It will resonate. And then the muscle and bone, they're so thick, things can pass through, they give you flatness. So the only thing I give you flatness is 4 and 5. Number 11. And next is doing abdominal assessment. Which of the following the nurse should do before you should perform before percussing the abdomen? The nurse is doing abdominal assessment. Which of the following the nurse should perform before percussing the abdomen? If you have to assess a patient, first what? If the abdominal exams, like you have to observe, right? Let's look. Then what? Then you listen, you percuss, and you palpate. So what would you do before percussion? You palpate all 4 quadrants, give them pain medication, listen, or raise their head out of bed 30 degrees. If you palpate, it will make your percussion inadequate. If you provide pain, then it does not help at all. Or auscultate all 4 quadrants. Yeah, before you percuss somebody, you have to listen first. Otherwise, when you're listening, you do that, it's going to be a problem. And then head of the bed, usually we want it to be flat. When you're listening to somebody's abdomen, they have to be supine, no head of bed, so that the exams is much better. So what you perform before you percuss, I want to listen to all 4 quadrants. The last one. An outgoing nurse document a Macewen sign. If you know this, you know it. It's easy. Macewen sign on the chart. Which of the following is consistent with the documentation? Documentation. Select or apply. Or is asking you, you see, underline the buzzword. Macewen sign. What do you think it is? Is appendicitis give you that? Cholecystitis give you that? Hydrocephalus give you that? Brain abscess give you that? And angina give you that? This is what we call if this is the individual score, okay, at the temporal area, at the frontal area, those areas, and then at the parietal area. So temporal, frontal, and parietal bone. Where they meet? On the side. If you percuss here, if you tap that area, it's going to give you some hyper-resonance sound. Hyper-resonance sound or crackpot sound. When you hear that, the patient has either hydrocephalus or brain abscess. This is exams you should be familiar with. It's a bonus question, but if you get it, good. Macewen sign is we use it to diagnose hydrocephalus. That means too much. Your head, the ventricles are big, it's made up of fluid, and your head is bigger. Or brain abscess. So Macewen sign, you tap at the temporal area, but you check where the frontal bone, the temporal bone, and the parietal bone join together. When you tap it, you hear a hyper-resonant sound, cracking sound, and that is the indication of hydrocephalus and brain abscess. That's my bonus question for you if you never heard it before. Take care of yourself. Thank you for following Adaptant class. This is a series, 2 more to follow. Take care of yourself and have a good day. Bye-bye.